Good day everyone. For this video's topic, I will be discussing the underlying aspects of coronavirus, its impact to human race and industry, and steps we must practically apply to help prevent this deadly virus that currently spearheads the world's populations and overall economy. I would like to begin by explaining what is coronavirus means. Basically, it is called COVID-19. It is newly discovered infectious disease which spreads through droplets of saliva or discharge from nose of the infected person. When they sneeze or coughs, the pandemic was declared a public health emergency of international concern by WHO or World Health Organization on January 30, 2020. As days pass by, the virus become fatal in our country, and it is continuously spreading illness or hitting 25,930 cases in the Philippines within few months. As of this moment, there are no specific vaccines or cures yet that could help ease the virus. Some scientists and doctors are still undergoing the authentically by going clinical. Some scientists and doctors are still undergoing authenticity by going clinically trials and evaluating potential treatments in order for us not to be part of be physically infected and show to down transmission. We are advised by professionals to wear masks, disinfect things that had exposure, wash our hands with water or alcohol or frequent as possible, and follow the physical distance measures. Let's now further discuss this talk in area of hospitality industry. According to the research, business level that impacts of the crisis have reached every industry in the world, with the travel and tourism taking a massive hit according to OGA or Aviation Worldwide. The travel restrictions on the international flights have caused the global airline industry losses up to 800,000 US dollars. Many hotels find themselves empty and looking filled with the once full lobbies and rooms. Nevertheless, the grave situation has given space for the worldwide and have with many hotels around the world providing their premises to the house medical staff, first responders or hospital patients not suffering from coronavirus. Here are some guidelines from Monitor Employee Health and Personal Hygiene. First, per existing FDA or food code requirements, employees who are sick should remain home. Second, if an employee should become ill or present of illness, the operator should identify that during a pre-work or screening and follow the established policies on when they are allowed to return to the work, but a minimum of follow of CDC guidelines to self-isolate for 7 days from the onset of symptoms and be symptom-free for 3 days without medication. Second, taking employees' temperature. It's the operator's discretion. The CDC has not mandated taking an employee temperature, and any operator who chooses to should engage health officials and adopt policies aligned with proper procedures. Next, we have monitor and social distancing. First, update the floor plans for full service restaurants, redesigning seating or arrangement to ensure the at least 6 feet of separation from seating to seating limit. Party size at tables to no more than established. Guideline maximums approved recommended by CDC. Where practical, especially in both seating, physical barriers are acceptable. Consider a reservation only business model or call ahead seating to better spaced dinners. Second, remind third party and delivery drivers and any suppliers of your international distancing requirements. Third, post signage or entrance door that no one will have a fever or symptoms of COVID-19 to be permitted in the restaurant. Fourth, limit contact between waiter staff and guests and where face coverings are not mandated. Consider requiring wait staff with direct customer contact to wear face coverings as recommended by CDC. Fifth, if practical physical barriers such as partitions or plexiglass our registers are acceptable. 6. Use technological solutions where possible to reduce person-to-person interaction by mobile in ordering, mobile access to menus, to plan, advance, or text on arrival. Do not allow guests to congregate in waiting area or bar areas. Design a process to ensure guests separation while waiting. To seated that can include floor makings, outdoor distancing, waiting in cars, and consider exit from the facility is separate from entrance, determine ingress or egress to and from restrooms. To establish facts that imitates proximity for guests and staff. Second to the last, reduce customer service phones in common areas. And the last but not in the least, increase length of time between vacancy and cleaning rooms. Next, we have hotel protocols, hygiene and environmental safety. First, we have cleaning of visibility, dirty surfaces, followed by disinfection in the best practices measure for prevention of COVID-19. Second, perform additional environmental cleaning of all frequently touched areas such as a front desk, elevator, banks, or coffee stations. Third, products with EPA or approved emerging viral pathogens claims as expected to be effective against COVID-19 based on data for harder to kill virus ensures used for linens and laundries. Social distancing more than 6 feet of employees and guests. Staggering of employees' schedules on both a shift and work week bias. Limits on interaction between departments. Working from home or telework. Tightening of restriction on visitors or off-duty employees in the workplace. Room service restrictions. It way to delivery a food or something. Eliminate or reduce in-person check-in and check-out with automated process tipping. Request guests to minimize direct contact with employees. And this ends my webinar. I hope you learned something from it. Thank you for listening and have a nice day. God bless.